Neck stiffness and dizziness are common issues experienced by individuals over the age of 60. These symptoms can affect daily activities and overall quality of life, often resulting from age-related changes in muscles and joints. Regular neck stretching exercises play a crucial role in alleviating discomfort and improving mobility. By maintaining flexibility and reducing tension, these exercises help prevent further complications. Understanding and addressing these concerns is essential for promoting well-being in older adults. Stiff neck and dizziness are common complaints among older adults, often resulting from a combination of health and lifestyle factors. Age-related degeneration of the cervical spine, such as osteoarthritis or herniated discs, can lead to muscle tension and reduced mobility in the neck. Poor posture, especially during prolonged sitting or using electronic devices, may worsen these symptoms. Additionally, chronic conditions like high blood pressure or diabetes can affect blood flow to the brain, contributing to dizziness. Lack of regular physical activity and dehydration are also important factors that can exacerbate these issues in the elderly. Neck stretching exercises offer several important benefits for overall well-being. By gently increasing the flexibility of neck muscles, these exercises help improve range of motion and make daily movements more comfortable. Regular practice can also reduce tension and alleviate pain, especially for those who spend long hours at a desk or experience stiffness. Additionally, maintaining good neck mobility supports better blood flow and balance, which can play a role in preventing dizziness. Incorporating these stretches into your routine is a simple yet effective way to support neck health and comfort. Neck stretches are especially important for individuals over 60, as they help maintain flexibility and reduce stiffness. Begin by sitting upright in a comfortable chair, keeping your back straight and shoulders relaxed. Slowly tilt your head forward, bringing your chin toward your chest, and hold for 5 seconds before returning to the starting position. Next, gently turn your head to the left, looking over your shoulder, and hold for a few seconds, then repeat on the right side. Throughout each movement, avoid sudden or forceful motions, and stop immediately if you feel pain or dizziness. Always perform these exercises slowly and breathe steadily to ensure safety and effectiveness. Establishing a consistent workout schedule is key to achieving long-term fitness results. By setting specific days and times for exercise, you create a routine that becomes part of your daily life. To maintain motivation, consider varying your activities and setting realistic goals. Tracking your progress and celebrating small achievements can also help you stay committed. Remember, finding enjoyment in your workouts makes it easier to sustain the habit over time. When practicing neck stretching exercises, it is essential to remember a few key points. Always perform movements slowly and gently to avoid strain or injury. Consistency is crucial. Regular practice will yield the best results over time. If you experience discomfort or have underlying health concerns, consulting a healthcare professional is highly recommended. Staying patient and attentive to your body's signals will help ensure safe and effective progress.